Why don't we go ahead and get started? Again, my name is Beth Edgerton, and I'm the branch chief here at HRSA over Emergency Medical Services for Children and Injury and Violence Prevention, and today is our orientation call for our new Targeted Issues grantees. So congratulations, first of all, for your tenacity and success. Again, thank you for taking time today, and also really thank you for your flexibility during our government furlough. I know it's been challenging for rescheduling and being in limbo, so we really appreciate your patience. If we could take a moment and kind of just do a quick roll call by teams. I see some people here on the line. So, Dr. Silverman, are you here, and do you want to tell me if anybody else from your team is part on the call?
I'm here, and Patrick Shepard, who is one of our research associates, will be joining any second.
Great. Well, welcome.
Thank you.
And Dr. Fallett, how about from your team? I see you're logged on. How about Dr. Lerner and your team?
Yep, sorry, I didn't put my last name in. I'm on, and Brittany Farrell, our notable administrator, is on.
Great. And we didn't know if any of your EMS leads are on, too, or just the two of you?
Just the two of us. I didn't think we needed them, sorry.
Okay, fabulous, fabulous. And Dr. Manish Shah, how about your team? Finding the unmute button. Manish, do you have anyone besides yourself on the call?
No, it's just me.
Okay, great. And anybody from New Hampshire? Dr. Roddy or any of his team from New Hampshire on the call? How about Dr. Fallett, are you on the call? We see you logged in. I don't hear you on the audio yet. And anyone from the Indiana team on the call?
Yes, Dr. Stevens and I'm listed under Casey, are here from Indiana.
Great, welcome. We'll give Dr. Fallett one more chance just to make sure he has hooked up to the audio. I appreciate everybody's patience while we're working out the logistics. I just want to make sure that everybody can be heard before we get started. Mute, kind of cut down the background noise. While we're waiting for Dr. Fallett and Dr. Roddy's team from New Hampshire, I want to introduce our HRSA team, and I have my colleague Diane Pilkey here, and she will be your official project officer of record here at HRSA. And unfortunately, Teresa Morrison-Quinata wasn't able to join us today, and she's our program director for our EMSC program. And at the NRC, if you all want to introduce yourself, I see Angela Mikolai, the executive director, on. Angela, do you want to introduce yourself and your team?
Yes, good afternoon. This is we're so delighted to meet all of you by phone. I've been on board for about 4.5 months, spending most of my career in childhood injury prevention, and I'll let my colleagues introduce themselves. Demetria?
Hi, I'm Demetria McKimmon. I am the research program coordinator at the National Resource Center, working with the Targeted Issue grantees.
And Anne, are you on the call?
Yes. Hi, I'm Suzanne Salmon. I'm the Senior Communication Specialist at the EMSC National Resource Center, and I'm on the call. Well, basically what we will be doing is just providing you consultation with resource development.
Great, thank you. And hi, Dr. Fallett, can you hear us, or can you either type in the chat room or introduce your team if possible?
Can you hear me?
Yes, welcome.
Good. Hi. This is Beth McClure. I'm Dr. Thalik's research nurse. I'm here with Lindsay Boomer, who is our research coordinator, and Dr. Thalik is walking over from clinic as we speak.
Well, fabulous. Well, again, thank you, and we'll get started. So for the moment, if people can put their phones on mute, that would be great. We're going to take you through a whirlwind orientation, introductions, leave you with lots of questions. Don't worry if I go quickly through the slides. You've been sent copies, and you can use them as reference to come back to, especially regarding our wonderful electronic handbook, which you'll come to love, and all of the obligations of financial reporting and things of that sort. We'll have a separate session on that. So this is kind of orientation, hello, and what's coming your way. So we'll get started. So again, I want to just introduce our staff that will be primarily working from you, that this is the HRSA staff that's involved with our Targeted Issues program. Again, we'll give you an introduction to EMS for Children's program. We'll have each of you give us a quick overview of your grants, and we look forward to December of getting more of an in-depth understanding of your projects and understanding what's going on in your states, introduction to our resource centers, and then the role of HRSA, program staff and grants management, our philosophy of collaboration here at EMS for Children, upcoming program meetings, conference calls, and grants management issues. So all in an hour or less. So we'll see how we go there. First of all, I kind of wanted to give you a grounding of where we live in the world of the government. We're part of one of the operating divisions of Health and Human Services under Secretary Kathleen Sebelius. We're at Health Resources and Service Administration. The reason I put this slide up is just so as you do your work, if there's intersections with any of these federal agencies, we can really serve as a coordinator and a navigator for you, and for you to see that EMS issues may live in all of these different divisions or select staff divisions, so that we can really help facilitate collaboration beyond your project. Again, we're within the Maternal Child Health Bureau at HRSA. Our Associate Administrator is Dr. Michael Liu, and that's where our branch for EMS for Children and Injury and Violence Prevention lives, under my direction. We also have the Traumatic Brain Injury Program here at Maternal Child Health, so you're aware of that. Also located at HRSA is the Office of Rural Health Policy, which is important to some of your projects that you're putting forward. They oversee critical access hospitals and our telehealth program. And also we house the Healthcare Systems Bureau, which is where the Division of Poison Control and Healthcare Facilities is housed. Now, specifically for EMS for Children, for those of you that are new to our program, our goal is to really ensure optimal pediatric care for all children across the continuum of care, so both in the pre-hospital setting through the hospital setting. And again, we look to highlight the pediatric priorities, but in the end be integrated into the overall EMS system. We use performance measures to assess our pre-hospital and hospital infrastructure, and we'll discuss that a little bit more as collaboration. So in each of your states, there's an EMSC state manager that's working on infrastructure within your state, so we help to support that collaboration as you carry out your project. We also have some national collaborative initiatives. Many of you may have heard about the National Pediatric Readiness Project to ensure every emergency department in the United States is ready to take care of children. Obviously, that will intersect with EMS systems. We work with the Department of Transportation Office of EMS on a culture of safety for pre-hospital providers, whether that's patient safety, provider safety, or public safety. And we're also involved not only within our own program, but other federal agencies at looking at issues of regionalization of care. Our program is primarily a grant program, and just for your orientation, when we mention other programs, we have 58 state partnership grants, so those are in our states and territories. We have 6 demonstration projects that are looking at issues of regionalization of care, and we'll try to intersect if your state overlaps with those projects. You are the new 6 targeted issue grantees, so welcome. And we also support the infrastructure for the Pediatric Emergency Care Applied Research Network, often known as PCARN. We support their infrastructure, and then they seek external funding for their actual projects. We have the support services of the EMSC Data Center and the PCARN Data Coordinating Center, both housed at Utah, and you'll be hearing more from the EMSC Resource Center as we go on. We also collaborate actively with the Department of Transportation, which is where the Office of EMS is housed. We have a liaison at Indian Health Service. We work with ARC, DOD, and the Uniform Services School of Medicine. We also have activities in the area of injury and violence prevention. Part of our program supports the maternal child health block grants in states, and we also support the National Center for Review and Prevention of Child Death. Again, those are the child death review teams throughout the United States. We're active in bullying prevention, which is a departmental level initiative, and also around safe sleep. And again, I'm just going through this very quickly just to give you a snapshot of our resources and where we may look for collaboration and intersects of your projects. And again, we work closely with ASPR, and those are kind of the areas that they have focus, and we can provide connection for you. I'll highlight the Hospital Preparedness Program, which is also in coordination with the funding through the Center for Disease Control, and also the Emergency Care Coordinating Council. Both focus on EMS issues. As I stated, we have a liaison dedicated to EMS for children at Indian Health Service. And there's other intersects of your work with their program. Again, the Center for Medicare and Medicaid Services, one focus there is the CMS Innovation Center, looking at issues around how care is provided in the pre-hospital setting. And again, the CDC, the Office of Public Health and Preparedness and Response, and their Center for Injury and Prevention Control. So that was your snapshot kind of walkthrough here of the Department of Health and Human Services. Again, ARC is a great resource for data regarding emergency discharge data and hospital data. And we're also excited as next steps possibly for some of your proposals would be the National Institute of Health has a new Office of Emergency Care Research, which is a coordinating office to help kind of navigate institutes that can help support pre-hospital research. Again, this is the first time for our EMSC program that we've really specifically targeted a setting in which to improve care. So we, over the next 3 years, have invested the $5.4 million to improve pediatric pre-hospital care. As you remember so well from the funding announcement, we had 2 categories. Most of you are in the investigator-initiated projects, and then we have Dr. Brooke Lerner and Brittany from Milwaukee that will be our demonstration EMS for Children Research Network. And again, the point of these targeted issue grants is they're supposed to be models for dissemination, cross-cutting, and of national significance. And I really am putting that out there because often when we have targeted issue grantees, they're kind of like, let me do my project, why are you calling me? And from the beginning, we're having you kind of start thinking about where the outcomes of your project can be spread to those that are in the field and ways that we can find collaboration to keep your work going. Again, I'm going to check in to see if we have anybody from New Hampshire on the call now. I know there was a challenge when we had to reschedule, so I think if Dr. Roddy or anybody from your team is on the call. Okay, so we won't get his quick study, but he will be focusing on innovating and improving pre-hospital pediatric care in the rural New Hampshire and Vermont area, and the establishment of the Center for Rural Emergency Services and Trauma Network for EMS providers, and this will focus a lot on provider competencies. So we're excited about that project. Hello? And Dr. Silverman, if you want to give us an update on your project.
Sure. So just as a quick background, as for every major treatment guideline, oral steroids are the treatment of choice for acute asthma in children in the emergency department setting. And as we all know, the sooner that steroids are given, the sooner they can potentially benefit children and possibly prevent hospitalizations, the need for an ICU visit, or maybe even the length of time in an emergency department. And there's actually a CDC work group that was assembled in the probably about 5 or 6 years ago, which recommended that oral steroids be incorporated into existing protocols. But most EMS systems do not have oral steroids as part of their protocols. So what we want to do is we want to try and integrate the recommendations, these recommendations from the CDC work group, into existing protocols in the fire department in New York, which is a fairly large EMS system and has about 1.3 million calls a year. And the goal really is to improve pre-hospital care for children with asthma. And our goal is to carefully examine the implementation process and the actual impact of the protocol on a number of different outcomes. We're also going to determine the quality of a range of data collected through the use of an electronic tablet-based system and see if this can be used not only to develop and expand an asthma database, pediatric asthma database in the pre-hospital arena, but also used to help develop and expand additional protocols that are either related or unrelated to asthma management in the city. So that's it in a nutshell.
Great, thank you. And I was wondering too, I found out a nugget about your medical school, if you want to share with the group about what occurs for those first-year medical students at Hofstra.
Oh, can refresh my memory. I worked last night.
They all are trained to become paramedics, is that correct, during their first
year? Yes. So Hofstra is one of the new medical schools. It's called Hofstra University School of Medicine at North Shore LIJ Health System. And it's one of the few medical schools, and because they're new, they were able to develop these really interesting and innovative programs to train medical students. And one of the programs that we have is as soon as the medical students begin their first year, really the first day of their first year, they become EMTs. I think there's like a 4-month course that's taught by the fire department, and they're trained to become pre-hospital providers, and they love it. They eat it up. And in fact, we have several students who've worked with us over the summer on some pre-hospital, unrelated to asthma, but some pre-hospital EMS projects. And so we're really excited about this. Thanks for reminding me.
No, and again, obviously this whole group is focused on pre-hospital care, and so I just thought that motto was an amazing one and really a nice exposure to give clinicians as they go through their training. Any questions for Dr. Silverman? I think we have someone from Dr. Roddy's group that's on, so I'm going to go back one slide, hopefully, and see if Tom can present for your group from New Hampshire. Tom, can you hear us, or can you unmute? Okay, we'll come back once he's connected. Dr. Fallon, if you want to tell us about your program.
Hello?
Dr. Fallon?
She is standing in the hallway taking a hospital call. She will be back in the room in a second. Can you come back to us?
No problem. We are flexible. Dr. Stevens.
Good afternoon. How is everyone?
Good. Thank you for joining us. Welcome.
Welcome. Thank you. We have a similar program to what they're doing at Hofstra. Hofstra and I have already been in contact. That we're taking a little bit different approach and being proactive in identifying high-risk pediatric asthma patients within the Indianapolis larger metropolitan area. And our program is mainly targeted at hitting those high-risk patients from discharge from inpatient hospitalization, emergency department, or 911 activations. And during the 3-year program, it's kind of progressive steps from identifying early and piloting the inpatient to hopefully much similar in the 3rd year, doing a similar kind of proactive approach of maybe possibly identifying these patients ahead of time and treating them at home before even a hospitalization is necessary. So we look forward to working with everybody. It's very exciting to be part of this bigger project.
Great. And my question for you, Dr. Stevens, in your application, so do you see some intersect with what's being renamed as the integrated mobile health or the community paramedicine kind of model or connections?
Yeah, I should have mentioned that. We're building off that, and community paramedicine or advanced practice paramedicine, it's taken many different names, but kind of the movement out of the Pacific Northwest and out of northern Minnesota, where I'm from, is taking paramedics out of their primarily reactionary role as 911. They show up, they do what they need to reverse life-threatening condition, transport to hospital, and utilizing their skills in a different way to be much more proactive and identify people that would be high risk for getting life-threatening emergency. So we're having a great time putting these guys through essentially a mini medical school in pulmonary disease so that they can become kind of that advanced practice community paramedic model for us here, targeting mainly the pediatric asthma.
Great. Well, we look forward to lessons learned on that one. Any questions for Dr. Stevens? Again, just as a reminder, if people have questions, there's that chat box in the right-hand corner that you're welcome to type in. Dr. Shah.
Can you hear me?
We can hear you now. Everybody's got
okay.
the mute button thing.
Great. Well, I had two mute buttons pushed. So, good afternoon. The project that I am working on is called Pegasus, Pediatric Evidence-Based Guidelines Assessment of EMS System Utilization in States. It is a project that uses the National Pre-Hospital Evidence-Based Guideline Model process to develop 4 evidence-based guidelines on airway management, allergic reactions, spinal immobilization, and shock. And these will be pilot tested in the Houston Fire Department, and then after some modification, will be implemented in collaboration with the 6 state EMS medical directors in New England, in Maine, Connecticut, Vermont, New Hampshire, Rhode Island, and Massachusetts would be the 6th one. We will be looking at data 1 year prior to implementation and 1 year post-implementation to evaluate locally in Houston some patient-centered outcomes. We'll be able to track data at the 2 major children's hospitals in the area for patients that are transported by the Houston Fire Department. And then in the New England area, we'll be focusing on data that's available in the NEMSIS database on a statewide level. And we will be having our first Guideline Development Committee meeting in a week in Boston, and should have draft guidelines by February and some guidelines ready for implementation next summer. And we have been fortunate to connect with Scott Rohde and Tom Tremarco in New Hampshire, since we overlap geographically in the scope of our projects. And so we're going to work collaboratively to ensure that the education that they put out is consistent with the guidelines that we're creating. And then also been able to do some cross-cutting work, or potentially we'll be able to with the CHAMP research node by having our Guideline Development Committee identify some areas of need for future study as we create these guidelines that can be proposed to CHAMP that Brick will talk about in a minute for potential future study as well.
Great, thank you. I appreciate everybody already reaching out and making some intersects here. Any questions for Dr. Shah? Okay. Dr. Lerner?
Hi, can you hear me okay?
Yep.
So our award is to develop the Charlotte, Houston, and Milwaukee pre-hospital research node that will be part of PCARN. So we have pulled together the EMS agencies at each of those places to develop the infrastructure to be a network for conducting research. Our primary goals are to basically develop the communication and the infrastructure things that we would need to be a node, including having developed like a Facebook page and a website for people who might want to do research with us, and then to develop at least 3 research concepts, and at least one of those to develop to the point of being a grant we also will be doing a pilot study with the purpose of demonstrating that we can all collect our medical record data, link to the hospital data, and then use that data as some of the pilot information for the grants that we intend to develop in order to be able to do research within the node.
Thank you. For Dr. Lerner? And Tom, have you succeeded in your audio, and can I go back to have you give a presentation about the New Hampshire activities? Okay. And one more call to Dr. Follett. I don't know if she's back yet.
Not yet.
Hi, Mary. We can't hear you. I see you're trying to speak, but we're not able to hear you. In the interest of time, I'm good. Hello?
She's not back yet.
Okay. I'm going to move on, and you can just drop me a note in the chat room if either Tom or Dr. Fowler are ready to talk, and we'll give you an opportunity to give us an update, but I'm going to keep us going. So now we're going to transition to some of the resources that are available to you all. We have NEDARC, which is, as I said, based in Utah, and they're our data center for most of our state partnership grants and our SPROC grants, and they help in the different grantees on our performance measures. They work closely next door with the NEMSIS data set, which is the National EMS Information System. So I'm sure many of you are familiar with that collection process. So they can be a resource of connections, understanding statistical help, or querying about data so that they're available for you. Unfortunately, they weren't able to join us on the call today, but their website's listed there, and a very useful group. I'm trying to think of they've been active obviously in our PEDS Ready assessment, and also they do conduct grant writing workshops that are very beneficial for your team or trainees you might have. So that's their services. As you've heard, we have the EMSC National Resource Center on the call, and we have Demetria, who is in the second row in the pink there, who will be your main contact at the NRC. And then at the bottom row in the third is Suzanne Selman, who is, again, a senior communication person. So I'm going to give them the format here to kind of go over the services and how they'll be involved in interacting with you over the next 3 years. So, Demetria, you want to start?
Sure. Hi, everyone. Again, I'm Demetria McCammon, and I'm your primary contact from the NRC in terms of the targeted issue grantees. So the NRC is one of the 2 EMS for Children support centers. We typically focus on the day-to-day grantee consultation, any type of administrative assistance, and the development of resources for the EMSC community and the EMS community. So in conjunction with HRSA, we host all the quarterly grantee and bi-monthly individual calls to check in, follow your progress, and help work with you to resolve any type of problems that may arise during the course of your grant cycle or through the whole process. We also have a targeted issue webpage that has the dates for all of the quarterly calls. In addition, I typically will send out meeting invites or anything like that to alert you of new meetings. And in terms of resource development and dissemination, we attend a lot of national meetings and conferences for EMS stakeholder organizations, and we provide updates for the different targeted issue projects. Some of the meetings that we go to is the National Association of EMS Physicians, the Pediatric Committee specifically. We also release the new manuscript publications on our website under our publications page, and we have also recently done targeted issue webinars that will usually happen at the end of a targeted issue grant. And what we do with the webinars, we've had anywhere between 100 to 200 participants, and basically the targeted issue grantees will disseminate their best practices, any types of products that they have developed, resources, toolkits, and anything of that nature. Another resource that we have is our targeted issue database, and all of you guys are in the database. You can feel free to go on our website and look at that. It has the title of the project, the institution, the funding award, a brief description of the project, and the principal investigator. And now I will let Suzanne Selman, our communications specialist, talk about what she does in terms of product development and our EMSC Quick News.
Hi everyone, Suzanne Selman with the EMSC National Resource Center. What we are going to be doing, what services we provide to our TI grantees is just helping them if they have a product for national dissemination. And I read through some of your submissions, and a lot of you are creating products for more local distribution to help you get your study up and running and to communicate to maybe some participants within the study. We're not talking about those types of publications. The publications that we really focus here at the National Resource Centers are those that you want for national dissemination. Some of you already have them identified as part of your projects, others do not. And we'll be glad to help with you if you're interested in developing a national product based on your grant work. In the next couple of weeks, we'll be distributing to all of you what we call our product submission flow chart, which will outline the process for you if you want our assistance in developing a product. Some of the products we've done in the past are online training programs, websites, downloadable PDF documents that are interactive, and we're open to just about anything. If you have an idea, just give us a call, let us know about it. But the product submission flow chart should be coming your way, and that will provide you with more information at that time. The other thing we do is EMSC Quick News. If you are not receiving that, it goes out each Thursday. Please let us know, and I will make sure that you get on our distribution list. But as I said, that goes out each week, and we will include updates about what TI grantees are doing, specifically if they have an upcoming publication or they're speaking at a conference about their project.
Great, thank you, Dimitri. Are there any questions for either one of them? I'm going to ask people to mute. Someone has a little bit of background noise going on. Again, we will be reaching out more for information if you have questions. I would like to honor, I think, Dr. Fallett, you're back on?
Yes, I am.
To go back to your slide, and if you want to introduce yourself and your project, that would be great.
So I am a pediatric surgeon in Louisville, Kentucky, and I have had a long-standing interest in pre-hospital care. Can you all hear me?
Yes.
Okay. And in particular, I've had a concern about how well we prepare EMS providers to deal with a death in the field. In particular, I've been interested in the trauma patient, but I know that there are a lot of other challenges for EMS providers with SIDS and with children now who have special health care needs. And I think what the long-term goal of the project is to ultimately have some type of educational program for EMS providers that not only helps them offer parents the next steps, but also to do self-care for themselves. And in this 3-year project, we will start with focus groups. We've already started to have focus groups with our EMS providers in Kentucky, and we at Coast Sierra Children's Hospital where I work, we're very fortunate to have a bereavement intervention program that we've had for many years where the chaplains meet with families who've lost a child, and it can be for any cause of death, either emergently or someone who's been chronically ill. But we have the ability to go back and identify families who lost their child acutely and may have had an EMS experience, and to try to determine from those experiences what might have been done better, what might be helpful in those situations. In many cases, our chaplain here who runs the program has a special relationship with many of these families, so we feel privileged to be able to call on them to help us with some strategies that might be helpful in the field for all different kinds of patients. And we also hope to be able to reach into the rural areas versus urban areas. Kentucky is primarily a rural state, so we have all different types of EMS services as well as small hospitals and counties without hospitals where a child might not have had the ability to have an ALS service come to their home. So I think the overall approach will at least begin with trying to get some feelings for what should be in this type of program, and then we have a very good simulation program here where we hope to reenact some of the simulations that EMS might find in the field. And then once we have those validated, then we will have some training here, and then we'll take those to some of the national EMS meetings to see what educators feel would be important strategies to put in an educational program. And then in the third year, we hope to develop an application that might be on a smartphone or a computer, and that could either be available in the field or something that somebody could look at if they were going on a run, or actually refer to later if they needed continuing education on the subject.
Great, thank you so much, Dr. Fallon. And again, at HRSA, we're excited because we see lots of intersects with not only our joint activities with the Office of EMS and the culture of safety, because there's a lot of, as you said, self-care for the provider, and then how that has a secondary impact of one's job performance. And I think also just cross-cutting issues on dealing with the death of a child, whether some of our child death review teams, EMS, are the first responders, and disseminating that information. So we look forward to your project. I think we're going to give Tom another try. He's been very patient to see if he can update us on the wonderful state of New Hampshire's activities. Any luck, Tom? See if he can unmute. So again, oh, hello?
Hello, are you able to hear me now?
We are. Welcome, and thank you for your persistence.
I apologize. Apparently, if you don't have a user ID plugged into given by WebEx, you can't participate. I could hear the call, but I couldn't actually talk.
Well, we're glad to have you. Welcome.
Thanks for the patience. Our grant award up here at Dartmouth is focusing on a couple different areas, and it is really trying to set up a network to be used for educational purposes as well as competency assessment purposes. New Hampshire is quite a rural area, obviously, and many of our agencies are a mixture of volunteer and career departments, and with various levels of training for our pre-hospital providers. And we find that there's a large need from the educational side for these providers, as well as the competency assessment side, making sure that the providers actually are able to do what they say they can do year in and year out. And so the goal of the grant is really to build two toolkits that could be utilized at the department level and the regional level to help ensure adequate pediatric education, as well as the competency assessment of the topics that we feel are high yield. So in working with several regional hub hospitals and the local EMS agencies around those hub hospitals, we've set up a network, or will be setting up a network to provide these educational services localized in a more regional area, using teleconferencing and web-based communications, didactic sessions, podcasts, and ultimately a mobile simulation as well, to be able to travel to these different hub hospitals where the local EMS agencies will be utilizing as their resource hospital for the PD education. Once we've gotten through kind of the educational cycle, we're also then looking to implement the competency assessment toolkit, which is really geared on developing several tools to help agencies and training coordinators better assess their providers and make sure they can actually do the skills they say they can do. And it's a combination of some high-fidelity simulation with the modification of using a global assessment scale built into that, as well as some more traditional models also.
Great. Thank you. Any questions for Tom? Okay. Going to keep moving forward a little bit more. We decided you should probably see who we are, since we're virtual. Myself, and then in the middle, Diane Pilkey, who will be having the most contact with you. And Diane, why don't you give a little bit of your background?
Sure. So I'm actually a relatively new employee here at HRSA. Last few years I've been working at the Office of the Secretary in the Office of Policy, working on Affordable Care Act stuff. But in my prior existence, I came from the Washington State Department of Health, where I worked on maternal child health, injury and violence issues, and before that I was a practicing nurse for many years, predominantly in the emergency department settings in various levels of hospitals. A little bit of work in local public health, a little bit of work working with ambulance services on EMS type calls. So kind of a big variety of issues. And most of my time in Washington State, I was working as an epidemiologist.
So we're glad to have her clinical perspective and epidemiology experience and project officer. So you're going to get 3 for 1. And unfortunately, I said Teresa Morrison Quinata wasn't able to join us. And our grants management person, Donna Gareth, wasn't able to join us either. But at least you'll have familiarity with these names as you get random emails from HRSA. So we wanted to give you some grounding on that. Again, what is the role of HRSA? Our main role is project oversight, just to ensure that we support you in the completion of your objectives and reporting obligations. Again, we appreciate citation of your funding source as you make presentations, publications, or products. One is just so people know that federal funds have supported your activity, and also it just promotes our investment so people see the value of where we're putting our information. We will also be involved in coordinating the project support with the NRC as we work to promote dissemination of your work, and also reach out to other stakeholders that might, again, help you along in your project. And as I said, we're a big promoter of facilitating next steps once your targeted issues project is completed. We've been very successful in the past, if you go to the NRC website, to see where initial thoughts or projects started off as targeted issues and then have gone on to much larger scale studies or projects that have made a really impact in the care for children. So we have high hopes for you. You didn't know what you signed on the dotted line. Also, we're going to be coordinating our program site visits, and the purpose of this is multifold. One, to ensure you're meeting project objectives, and sometimes it's helpful to have staff come to you and see what's going on in the field that you're working in. Provide consultation as appropriate, so if you need some expertise and we have access to that we can provide that for you. Help optimize partnerships within the state, just so that you know we're really going to be reaching out to all of you to make sure that you involve your EMSC state partnership manager They're busy working on the infrastructure and kind of care components of children in the EMS and hospital systems, and we want to make sure you're aware of each other and even potentially communicate every once in a while. And when we come out with our site visits, we try to invite the EMSC state manager also, and as I said, support the dissemination of your findings. That's a real goal of ours, and especially with these targeted issue grants. Again, we hope most of these will end up in some form of publication, but we realize that there's other forms of dissemination to assure that items get to the field. Logistically, we've learned over the years that right now is not a good time to visit you. You're kind of like, stay away, can we get our project going, leave us alone? So that we found the best time is usually in the beginning of that second year. You've gotten your feet, have a sense of your project's changing direction or not, and hopefully we can be the most use with you. So we'll be coordinating that with the NRC staff in the next few months. The best part of getting a grantee at HRSA is grants management. You will learn to love the electronic handbook. The good news is I'm going to kind of go through these slides quickly, and T will be having a separate session with Diane to kind of go over grants management, so whoever on your staff is really going to be doing that entry and interface. That's a really important webinar to attend. We are still learning ourselves here at HRSA, so don't get frustrated. It's a group process, and we're here to help support that. Again, there's a tutorial that's available for you. There's cycles of reporting, which will cause you confusion all the time. Don't worry about that. We're here to answer those questions. These are the different reports that will be coming up. The one that's most important for you that's due December 1st is the post-award performance report. And while that sounds intimidating because you said we just got our award, what do you expect us to report on? Primarily it's you articulating what you plan to do in this first year. So pretty much it's what you stated in your grant application. There's not a high expectation that you've accomplished or not. There are a few of you that may be having what we call conditions on your award, and those are requirements in the funding announcement of whether it's documentation about your indirect agreement is missing or a component of your budget is missing, and that communication will occur with Donna, or it could be possibly need for IRB approval or exemption, and we'll be looking for those documents. I'm going to keep going through this because, as I said, T and Diane will have a special session on that of all of these components, and again, you have this information on the slides as reference. The other issues I shared with you, we really like to get a lot out of our investment, so we really push collaboration. And the first venue that we have for that is our grantee meeting. We have all grantee meeting every other year, so that will be this July. So if you could mark that date on your calendars, July 29th through actually August 1st, I apologize. And expected to budget for that for attendance. This is also a great opportunity in the next week or two, if there are topics that you think are really important that you want to hear about, that you submit that to either Sumitra or Diane, because we're in the process of developing the agenda for that meeting. So at this all grantee meeting, not only is it our 30th anniversary for EMS for Children, so we're excited about that, we have our researchers from the PCAR network will be in attendance, yourselves as targeted issue grantees, and even if you're a new awardee, your thoughts or interests are very important to us. We will have our SPROC, our Regionalization of Care grantees, and our state managers. So again, important if there are certain topics that you think are cross-cutting or you would want us to highlight, let us know. Conference calls, as we stated, we try to have some calls that are groups so that we can share and kind of understand what all the target issues are doing, and then we'll have individual calls to, deal with issues that are very specific to you. And as we said, that you may see notices that you get from HRSA that may either come from program or may come from the grants management office. And they're the ones that actually handle your notice of award and reporting issues. Program works with them in consultation, but the actual agreement, fiduciary agreement, is with grants management, and that's Donna's office. So if you're don't worry. Again, our contact information is here with questions and comments. As I said, Donna is your grants management person, so if there's issues around financial components, that's the individual to seek out, and Diana Pilkey will be your main project officer contact. Other things that I just wanted to touch base is that on December 11th, I think Sumitra has reached out to most of you to hold the date. And what we'd like to do at that conference call is to expand what you've shared with us today of what the components of your project are, more like a 15-minute presentation. And who we anticipate to be joining us on that webinar would be not only yourselves and your project staff. We're going to specifically reach out to your EMSC state managers in the states from which you're partnered with and our other grantee portfolio. So again, what we've heard a lot about is that our grantees and our EMSC community hear about these targeted issue projects at the end, and they're like, I'd only known in the beginning. So again, there's a lot of pressure on you. We expect high performance from you all, and you guys do great work. So we've had a lot of requests that people get a chance to hear about what your projects are in the beginning. And I know as a grantee that can sometimes be intimidating, that you're just getting your feet wet and you're not quite sure where you're going yet, but again, it's useful to our other grantees to have you do that. So if you have questions, reach out to Diane or Sumitra. Again, we're looking for just a 10 to 15-minute presentation that, you know, someone can understand of where your goals are, who's involved, and potential for some dialogue with your fellow state managers in the states that you reside. And I think those were most of my things. As you can tell, I'm a fast talker as my staff gives me a hard time, which means that we're efficient with time. I want to open it up to the NRC to see if there were any issues, and also to those on the call who have other questions. So again, you have two options: unmute, or you can send a question through the chat room. The date for the December webinar is going to be December 11th, and it's from 11 to 12:30 Eastern Time. Any other questions or closing comments? Again, thank you so much for your time and your patience through our activities. For you to know, too, that you all are functioning on FY13 funds. So our current continuing resolution and all of those issues shouldn't impact you right now, so don't worry about that. And we will be in touch and look forward to hearing from you all on the 11th of December. So I'm going to bring the webinar to a close and thank the staff at the NRC for helping us put together and provide technical support. And we'll be in contact.